Yes.
Or at least I almost understand. Oh, quite as long
Right.
as you all do.
Yeah.
Okay,
Right.
all right. Pretty good.
Thank you. Good afternoon and welcome to the Insurance and Pharmaceutical Subcommittee of the Health and Government Operations Committee. We have a very limited agenda today, just one bill. Um, and I, at this point, am not predicting any additional meetings of this subcommittee, but that could be famous last words. So don't count it as definite quite yet. Um, the bill we are hearing today, or we're discussing today, is House Bill 1515, CON Intermediate Care Facilities Exemptions. This bill was a victim of a 9-hour hearing, or hearing day, where this was the very last bill of the day, which was happening, the hearing was happening about 10:30. And I have a feeling that a number of people left a little confused about what the bill did. So I want to make sure that we clarify. It's really straightforward in the end. And I want to make sure that we clarify and see what other questions folks have after that. So with that, Aaron, would you tell us what House Bill 1515 does?
Okay, so under current law, a CON is required to establish an intermediate care facility that offers medically managed residential substance use disorder services. So this bill would change that current law requirement, sorry, and provide that a certificate of need is not required for the establishment or operation of an intermediate care facility that offers medically managed residential substance use disorder services if written notice of the intent to establish or operate the intermediate care facility is filed with the Maryland Healthcare Commission at least 45 days before the establishment, and the commission in its sole discretion finds that the proposed intermediate care facility is not inconsistent with the state health plan, will result in the delivery of more efficient and effective healthcare services, and is in the public interest. Now, also under current law, once these facilities receive a CON, there is no oversight when bed capacity is changed. So the bill also would alter that request for change in bed capacity in these facilities by providing that the CON is not required to increase or decrease bed capacity if at least 45 days before increasing or decreasing bed capacity, the facility provides written notice to MHCC of their intent to change bed capacity, and the commission in its sole discretion finds that the proposed change is a change in bed capacity at an intermediate care facility that offers medically managed residential substance use disorder treatment services and has a current license issued by the secretary. So the bill is providing oversight for both the establishment of the intermediate care facility that is a little more streamlined than the current requirement for establishment, but also providing them with some oversight when those established facilities change bed capacity.
Okay, so I'm gonna try to put it in 2 sentences. Thank you, Aaron. But number one, it describes an expedited CON process for a very specific kind of facilities, and they are facilities that treat uh, um, substance abuse primarily, and they're, residential facilities. And it also says that if they're going to increase capacity, there has to be a process for that. So that's really what the bill does. I got it. Thanks. So Delegate Johnson, you have a question actually, before I go to Delegate Johnson, let me look to Tracy DeShields or Winnie Hawk. Is there anything else you need to add to this information?
I'm going to defer to Winnie.
Okay.
No, I think you, Delegate, thank you, Chair Cullison. I think you actually stated it very succinctly. And really, the thing that I want to emphasize is that there's still, unfortunately, I think the name exemption from
Right.
CON is a bit misleading. They are still subject to the CON process, and that seems to have created some confusion. And what that means is they still have to go through all of the state health plan standards and satisfy those. But the main difference is that because it's this exemption process, it's an expedited review within 45 days, as well as it's a faster process. It also eliminates the involvement of an interested party. Those are the two main differences from obtaining a full CON.
Okay, and that's what expedites it.
Correct.
There are less entities involved in the CON process.
Mhm.
But in terms of the assessment of the CON, it's as robust as it would be without this.
Yes, it is.
Okay, Delegate Johnson.
Thank you, Madam Chair, and thank you, Winnie, for that, because it is confusing, because it says repealing the exemption of the CON. So are they currently under the CON or not?
Correct. Currently, to establish a new facility or to relocate a facility, they are required to get a certificate of need, which is the full-blown process. So what's not under the regulatory aspect of the commission are, if you are an established facility, you already got your CON 5 years ago, or maybe you just got it the last year and you're open. When you want to expand capacity and add more beds, the MHCC has no involvement. They just have to provide notice to us. And, the problem with that we've come across, and the problem that this bill is trying to solve, is that we have come across some facilities that are stacking as many as six patients in a room for the highest level. And the 3.7 intermediate care facility is essentially the highest level of care outside of a hospital. So you have really sick patients. And from a quality perspective, we were concerned about, 6 people to a room or stacking people in a room, because it's one of the most profitable levels of care. So a lot of facilities are just simply giving us notice, adding a ton of beds. I mean, I think one of the examples we gave in the bill hearing was that, in 2017, there was a CON for 21 beds. And as soon as they were licensed to operate, we received notice to add 81 beds. So
Thank you. That's always been my concern about releasing anyone from a CON, is with a 30-day notice, they can pretty much do what they want to do.
That's correct. And so I think I think it creates a really level and balanced approach, because what happens now, what can happen now also, is that if you have a new facility that wants to get established in a jurisdiction with another this facility of this type, they can negate the need aspect of the state health plan by just sending us a notice and adding the beds, and make it more difficult for any new providers to come into the market. And that's what the exemption, I'm sorry, it just creates this misleading sense that there's no CON oversight, but there is.
Thanks for clearing that up. Thank you, Madam Chair.
Mm-hmm.
So, so I just want to again emphasize the notion that we are not in any way reducing the standards that we have for establishing these facilities. It is just what I'm calling it an expedited process, but the term exemption is it's in COMAR for some reason, and maybe we should look at that in the future, but not today. Any more questions on the bill, or anyone need to say anything else about it? Delegate Taveras.
Okay, I have, well, one of them may be a little combined. So one is that just making sure the con is there, is just expedited. And in page 2, line 13, I just want to make sure that what I'm reading and understanding here is that we can grow the number of beds beyond the total number of bed capacity of the building.
we cannot grow beyond the total capacity. And unfortunately, because there's been no structure to review that in a comprehensive way, that's what we're trying to correct.
So that's a cap, that's like, okay, we could grow beds, but we can't grow it beyond the total capacity of the beds.
Right, exactly.
And so through the con process, there is continuous oversight over the number of beds that exist inside that building. And so that's the oversight that's going to be given to whatever beds are constructed. Is that,
Well,
so if we do expand the number of beds for substance use disorder.
well,
When-
let me just say this. I
Mhm.
think for the certificate of need process is a review process that ultimately gets an approval. We don't have ongoing oversight. After the CON is approved, they get licensed by the Behavioral Health Administration, and they would be the ongoing oversight of licensure. But in terms of, I mean, what's happening now is we don't have any control of existing facilities adding capacity. And we think that's the missing piece.
Because
It
it doesn't exist now. As we establish hospitals, there is no behavioral health requirement. And we're trying to extend that so that there is possibilities for increasing the number of beds.
Well,
In
for a
these
hospital, it's
facilities.
slightly different because they would probably be psychiatric beds, which is a totally different, that's a different type of a certificate of need. I think, if I'm hearing your question correctly.
Delegate Taveras?
Well, I mean, it just says that this is offers medically managed residential substance abuse disorder treatment services. So that's what I'm interested in.
So
That's right. So the medically managed, that's a 3.7 intermediate care facility. That's not hospital level. Hospitals are different, totally differently regulated facility.
Right.
So.
And Delegate, I think what you're trying to get at is the need for increased beds. We want to be able to increase them, but we want to do it responsibly. And
Yes.
right now we don't have the mechanism to do that. And this bill would provide that mechanism. Does it help?
Yes.
Okay, great. Any more questions, comments? If not, can I have a motion on the bill?
Move favorable.
Okay,
Second.
Second.
I've got a motion and a second. Any more discussion on the bill? Seeing none, those in favor, please say aye. Raise your hands.
Aye.
Okay. Will there be any opposition to the bill? Any opposition? Seeing none, the bill passes unanimously. And thank you all very much for being here today. That concludes our work. We have a voting session at 2:00. So you government ops people, please get some rest for the next 10 minutes or so before we go into
Thank
voting.
you all. Thank you,
Thank
Chair.
you.
Thank you.